Hey, everybody. Real honor to be here. And I'll try to keep it quick because we're a little behind. And reflecting upon the comments of the dude, he kind of said it all, certainly with respect to my message. I'm a psychiatrist. I'm a neurobiologist. I did all my research at the Longwood Medical area. And after all that experience with treatment, studying the brain, it really is about interpersonal relations, support, kinship, that I think at the end of the day makes the biggest difference and really needs to serve as the platform for everything that we do. When we talk about moral injury, we talk about a disconnection syndrome. So when I think about that string, and I think about the well-being of the military community, I reflect upon something I say a lot, which is that none of us is well until all of us are well. And then we have to weave those strings throughout our community, throughout our society, and in our policy. The first thing I'll say is that, to paraphrase George Washington, the willingness of our next generation to serve our country will depend upon how those who have gone before them are treated when they return. So at some level, what we're talking about really is a national security matter. And I would say that we as a nation need to figure out how we create platforms for individuals who return after serving, not just so they can live a life housed or employed, but that they can flourish. And it's all about those platforms that I really currently work and currently advocate. And I'll tell you about my understanding of really the first reintegration paradigm, which is following the Civil War. President Lincoln created what was called the National Home, which was about 15 large campuses across the nation for individuals who were not assimilating, who were not reintegrating back into the community as civilians. And we've really lost that commitment. There is a property in Los Angeles where I live, the West LA VA. Used to run mental health there. And there's a big, for those of you who might follow it, lawsuit against the VA and the federal government, levied by the ACLU and other public interest lawyers. I serve as the expert witness. We're demanding that in the epicenter of need in LA County, where there are thousands of homeless veterans, that property be reactivated, and that we think as a nation about how to replicate the original vision of our President Lincoln. No disrespect to the VA. I poured a lot of my civilian blood, sweat, and tears into the VA. But really, what I'll say is that we've taken a very treatment-focused approach, a siloed approach, and one that really doesn't incorporate most effectively the actual needs on the ground, not just of the veterans, but also of the providers. And we have well-meaning, I'll give them the benefit of the doubt, decision makers about what are the solutions. And then at the end of the day, we try to figure out how to put that puzzle piece of our client ultimately into a larger puzzle, and it doesn't really work. And one of the things I'll say, again, as someone who's done a lot of treatment, provided a lot of treatment, overseen a lot of treatment, the social determinants of health and the spiritual aspects of life are absolutely fundamental as the primary platform. Things like treatment, things like good food, exercise, access to finances are critical tools. But ultimately, it's all about people, place, and purpose in life. We have to be connected to kin, whether it's our family of origin or our friends or a support network. Otherwise, we need places to live, to recreate, to relax. And we need purpose in life. which is a theme that I'm glad to say has come up so often. And there are new treatment paradigms being developed, adaptive disclosure, the psychedelics. And I thought that was an amazing talk that really framed a large part of our approach in the healthcare industry towards decreasing the disconnection that we experience and which leads to so much illness. And what I'd like to say also is that based on this image and what I've experienced, including in Congress, we have to let the grassroots drive the grass tops. And when we actually do that and we listen carefully about how we administer our funds and how we put out our resources, we'll be much more effective. These are old slides. These are from like 2010, when I was a relative youngster. I wasn't even bearded. But the idea here is not that the solution is Freud or any medical program. The point is that getting to care is extremely difficult. It's a maze. And I think we all know that. Anyone that's dealt with the bureaucracies of our lives will understand that getting access to resources, getting access to care can be unbelievably difficult. And ultimately, if we can leverage the veteran as a battle buddy based on that ethos which is developed during service to help the brothers and sisters navigate that maze, get to the resources that are needed, kick down the doors, whether it's at the VA or at other community organizations, it's a whole new day. Which is why in my career, I've not just in the veteran space, not just in the military community space, but more largely, more broadly, focused on peer support and peer support programming as a fundamental solution to the challenges that are faced by people who have all kinds of problems, including challenges, including mental illness, among others. Back in the day, there we go. Back in the day, I have testified to Congress about homelessness and suicide in the veteran population. And this is 2012 to 2013. And I told them that, in my opinion, and I still believe this today, the primary solution is looking at our veterans as navigators, as ombudsmen, as brothers and sisters to navigate these challenges for people and to keep them connected to their communities. I also participated in the development of the Clay Hunt Act, which many of you may know about, which really looked to compel the VA to create more peer programming, more vet-to-vet programming. I'll say that it's disappointing that not more has happened. I'll also tell you about programs that I've been working on and have worked on over the past decade. Bridge for Heroes, a small one. The Battle Buddy Bridge, which was national, working with a nonprofit. And most recently, the Veteran Peer Access Network in Los Angeles County, where I took $20 million out of the budget to buy housing and to pay veterans to be certified, trained, certified, and employed as assets for the department and for the community to do the type of navigation that I'm talking about. And I was speaking to someone earlier, I think his name was Zach. Zach, I don't know if you're here, but Zach came up to me and he's like, hey man, you were at LA County Department of Mental Health. I was like, yeah. And he said, you know this guy named Jim? And I was like, yeah, I do. Because he had just met Jim and they were talking about battle buddy programming. And Jim was a guy I met in 2008. And I developed with him the Bridge for Heroes program. It's the first of those battle buddy programs that I really worked on. Jim was a vet who was struggling with homelessness. His marriage had dissolved. He had fallen into addictions. Jim is now the director for the Department of Military and Veteran Affairs for Los Angeles County. And he's driving the Veteran Peer Access Network. And last week, Jim and I went to see a Vietnam vet who had developed Parkinson's disease, had terrible post-traumatic stress and other challenges that were invisible. And he'd broken his hip, and he had never connected with the VA. This was about 6 months ago. So we lobbied the VA all day long and veterans benefits for a guy that had been hiding from the system for that long. And it took 6 months to get him actually enrolled in the VA and to get his disability rating. And since that's happened, and since Jim and I have been connecting with him, his entire attitude has changed. He's now in a nursing home, and he's looking to move more towards a less restrictive environment, but he's engaging with the nursing staff. He's engaging with other vets, and he's been hiding from other vets for decades. At the end of the day, we talk about purpose a lot. I talk about purpose. I talk about purpose as treatment. And I've been trying to write a book about it, but I'm too busy doing other things. But we have to really, really think about that. What do we do when individuals are suffering and we allow them to become victimized and treated, as opposed to empowering them to be the heroes in their lives and for their community? The reason why I have a large wave here is that I, despite getting to be an older man, continue to surf as much as I possibly do. And my ultimate goal, if I had a purpose to be connected maximally, it would be to do what Laird Hamilton is doing here in this massive wave in Tahiti, which has got perfect shape. And I don't know if any of you saw this image when it came out, but when it came out, it completely blew my mind. And I think if we look at if we look at purpose as treatment, as a substitute for treatment, and we look at the veteran community, disciplined individuals who work in teams and are mission focused, and look to them to be the solution for the military community, and I would even say beyond, we'll be cooking with oil. And we won't have so many veterans who are suffering. The dude said, I've got PTSD, you're gonna diagnose me with mental weakness. Are you kidding me? We have to shift that narrative, folks. So my takeaway, or my call to action for everyone here, is to recognize that we have to move towards empowerment models, leveraging people with opportunities, not just services, in order to solve problems for those particularly those who have served. Thank you, this is me. If you're ever on the Marina Peninsula and you want to surf or just hang out, that's my email, and that's my phone number. Thanks very much.